Muscle strength, or more precisely, the ability to hold against a challenge of a force, is a baseline or a sign in medicine. And specifically in orthopedics, we use it a lot. In part 2 of my orthopedic evaluation, I'm primarily assessing range of motion, muscle strength, nerve tension, and a functional movement or activity. And I argue this a lot, but people don't seem to get it. Muscles do not randomly get weak. Something causes the muscle to get weak. It's not necessarily the fibers that are atrophying at the level of the muscle. And a non-random example or an obvious cause of muscle weakness could be being in an ICU bed for 4 weeks, or being in a cast for 8 weeks, or neurological disorders that present with muscle wasting. There are obvious causes of muscle weakness, but for those patients who don't have those causes, we need to attribute that weakness to something. And I find in 90% of cases or more that muscle weakness can be turned on relatively immediately, making the muscle strong within minutes or days. So here's 2 things that I often hear from patients and non-patients alike. Let's take an example of testing the anterior tibialis. It's the muscle in the front of the leg, so the shin bone area, and its job is to lift the ankle, bringing the ankle or the foot towards the ceiling, and it's called dorsiflexion. So for most patients with lower extremity complaints, I'm testing this muscle, and for patients with low back complaints. And let's say I test that muscle, I push down on the ankle and it goes down. So it's not 5 out of 5 normal strength because I shouldn't be able to budge the foot. Now, patients often say, oh, it's weak because I haven't been working out, or I used to be a jogger and I haven't jogged for the last year, etc. Now, if that were actually true, then not only would the right anterior tibialis be weak, but so would the left. And not only would the anterior tibialis be weak, but so would the plantar flexors. So would be the inverters, the everters, muscles surrounding the knee, muscles surrounding the hip. If you were going to be weak because of immobility, it would affect all of the muscles. So again, that challenge or that explanation doesn't work. And secondly, people often say, oh, it's just weak on that side because I'm left-footed. And while in some rare cases with athletes, there may be a difference that matters, for the average person, even if there's a small difference between the dominant side and the non-dominant side, I shouldn't be able to push that muscle down. It should not be observable clinically. So those 2 explanations do not count. If you're not moving, that doesn't mean that the anterior tibialis should get weak on the right. And if you're left-footed, that doesn't mean the anterior tibialis should get weak on the right. So the 2 main factors I find that would cause the anterior tibialis to be weak, for example, is an ankle joint problem or a low back problem. Mostly in the low back, a joint problem, but other things can irritate the nerves that go down and control dorsiflexion or control the action of the anterior tibialis. And if you want an explanation, we don't have perfect explanations when it comes to the ankle, but I think of it something like mechanical advantage. If the joint isn't moving well, the muscles surround it don't seem to fire like they should. And it's a similar explanation for the low back, although we do know specifically that there are myotomes and that the nerves that come from the low back specifically control specific nerves with specific actions. So before you blame the muscle fibers at the local level, especially if there was no cause, we need to be thinking that the muscle fibers didn't randomly just get atrophied and weak. Something is causing it. So look at the joint around the muscle. It could be, for this example, at the ankle, possibly at the knee, and look at the spine. Because for most patients, that's what I'm finding, is the muscle has been turned off or inhibited or mechanically disadvantaged or whatever term we want to use. It's just very cause and effect. If I move the ankle one direction and now the dorsiflexion strength is returned, or I move the knee, or I move the low back, and now instead of going down, when I push on that ankle, it stays strong. Are there times when it's weak and we do need a strengthening regimen? Yes, but they're rare, and they're usually in those cases where there's an obvious insult, like bed rest or like immobilization, that causes the muscle to get weak at the level of the muscle. So make sure you look for the root cause diagnosis, because in order to get effective treatment, you have to start with the right diagnosis.